Children found to have severe tooth decay should be referred to local safeguarding teams because it could be a sign of wider neglect. This is according to dental experts.
26,000 children between the ages of 5 and 9 were admitted to hospital because of dental problems last year. Claire Stevens from the British Society of Paediatric Dentistry joins us now. Very good morning.
Good morning.
Maybe the easiest way for you to explain this is you have seen individual children, haven't you, where you look at the teeth and then from what you see in a child's mouth, then there is a suggestion as to what else is happening in their life. Just take us through what you've witnessed.
Well, as a children's dentist, I have children coming in to see me every day, a lot of whom have widespread decay in their primary and their permanent teeth. But it's not just about what's in their mouth. As dentists, we're trained to look after the whole patient. So we look at what's happening in that child's social history, who they've come in with today, how long it's taken them to come and see us, perhaps with decay in their teeth or infection. And we look at the whole picture before deciding if that family needs any extra support.
It begs a couple of questions straight away. I mean, how do you find out that information? You're there to do treatment. Yeah, but what if information is not forthcoming? And in often cases where there is real risk to a child, for very obvious reasons, that information is not forthcoming.
Which is exactly why dentists need to be part of a bigger system that shares information. So we are trained to work with all health and healthcare professionals, but also school nurses, for example. So if I have a child that comes in to see me that I have concerns about, I will talk to the GP, I will talk to the school nurse, I'll talk to the health visitor. It's all about sharing information and communication because we know that we're one small part of a jigsaw.
And this is going to sound like a really basic question. How do you talk to the healthcare workers surrounding a child? You get in touch, you literally file a report and say, I want to talk to you?
I wouldn't file a report. I would pick up a phone and speak to that person one-to-one. We have people dedicated to doing exactly that within the hospital that I work in.
OK, and I will ask, is that because you have more resources?
I think it's not about whether you've got the resources or not. It's got to happen.
Well, it's time. You know, it is a resources question in many ways. It's a time thing. Because I just wonder how many dentists, one, feel that they are equipped in terms of training, but also in terms of resources, to be able to make the call to say, this child is being neglected and this child needs to be reported to social services or it needs to be flagged up. That's a big step, isn't it? And that's a big responsibility as well.
It is, but we've had guidance for dentists working in practice since 2009 now, and really good resources and training that are there to help dentists identify children who might be at risk and to support them to get further information about that child. But I'm working in a big hospital setting. I see, if you like, the more severe cases. So of course the trust that I work in is resourced to be able to support it.
What about parents watching today who, some might just not, some might feel they don't have control over what their children are drinking when they're on their way to school, at school. Some kids just have bad teeth, bad denting, inherited bad teeth, who think, OK, I need to take my child to the dentist, but I'm scared now. I'm scared I'm going to be blamed. And I'm trying everything I can to make sure my child's teeth and oral hygiene is good, but it's just not working. Now I'm going to be reported to social services.
That's absolutely not the message that is coming out of the work today. The work that has been published today is looking at children with severe infection, those that have had to go into hospital, stay in overnight because those decayed teeth have gone on to form life-threatening infections, perhaps involving the airway or the eye. Baby teeth do matter and they have the potential to cause harm. To parents that are watching this, I would reassure them, dentists are there to support, to educate and to look after the child that is at the centre of our care. So absolutely not. I want the exact opposite. I want families coming in to see me before it's too late, before their child needs admitting for infections like this. That's why we encourage dental checks by the first birthday, because we're there to support and prevent.
A lot of what you're saying makes perfect sense. We do come back to the issue of funding. I mean, you're able to run this out in your hospital, but what this idea of rolling out elsewhere, is that realistic? Who's going to pay?
It's totally realistic because in terms of somebody working in, say, a general dental practice, they might only have one family, you know, every few months. It's not a huge resource that we're talking about here. And what we're tending to do now is to look at it more regionally. So, for example, if a dentist working down the road from me has a concern, they know they can pick up the phone and talk to our safeguarding team. There's a whole network that is resourced across an area.
And just one last thought.
That's already in place.
The area that you work in is fascinating. How often do you see people in crisis with their teeth, children in crisis, who have never had any kind of dental care previously?
I see it daily. I see it daily. And the shocking thing is, you know, there isn't really many children that are born with bad teeth. That happens, but it is this very, very small minority. Dental decay is almost always preventable. And what we need to do is to make sure that children are supported by their parents to perform the tasks that we know every day that will help them prevent disease. So brushing twice a day, fluoride toothpaste, spitting out, not rinsing, going to a dentist early before problems arise, and also should problems arise, then making sure that access to care is timely.
Claire Stevens, thank you very much.
Thank you for inviting me.
Claire Stevens
Thank
is
you.
from the British Society of Paediatric Dentistry.